to start us off is John Johnson. He's a third year medical student candidate at the University of Alberta, cranking the gears on a biomechanics project at the Rehabilitation Robotics Laboratory. He's a book author, article writer, and program officer with the AIC. Unfortunately, he had a emergency. He emailed us this morning to let us know. However, we do actually have a video version of his presentation because John is just the type of guy who is prepared even in the cases of emergencies. So what we'll do is we'll play that. You can ask your questions in the text chat, and when he gets a second, he'll go look back at those and he can still answer any questions we have. So we'll start by playing that video, and then we'll get into the next presenters.
Hello, my name is John Christy Johnson, and today I will be presenting on the transmission control and prevention of Mycobacterium tuberculosis infection in the Arctic. My co-authors are Peter Anter Johnson and Austin Martin. So without further ado, let's get started. The tuberculosis is a stealthy and prevalent disease in the Arctic. It uses latent forms to be transmitted between individuals, communities, and even wildlife. As can be seen on the right, the Arctic biome and boreal biomes just in general have a very complex interplay of moving parts that make it quite easy to facilitate the transmission of tuberculosis from person to person and person to animal, as well as animal to person. Our central research question was, what strategies are effective in curbing the spread of TB in the Arctic? So the way in which we carried this out was to embark on a systematic review of databases. We looked at PubMed, Medline, Embase, and Google Scholar databases with no time, setting, or language restrictions. Keywords used included TB or tuberculosis, Mycobacterium tuberculosis infection, treatment, transmission, and Arctic. The inclusion criteria included any primary research, reviews, and gray literature that examined TB in Arctic communities. Now, PRISMA scoping review type guidelines were followed in the overall synthesis of our data. Our results suggested and indicated 25 papers that looked at this particular eligibility, that met our particular eligibility criteria. Of these, 9 were looked at screening or diagnosis of latent tuberculosis, so that which was not manifest. We found 6 papers that examined TB therapeutic management and other symptom management outcomes. And we found 4 papers that looked at transmission control or prevention strategies. Now, on the right, we can sort of summarize the results of these studies into 2 general categories. We can look at what's already been in place, so particularly looking at community initiatives, so work being done to ensure that there is medication adherence, as well as early immunizations to ensure that the population in the Arctic does not contract these types of bacteria. And we also looked at some of the more novel and innovative experimental approaches towards trying to mitigate tuberculosis spread. And this included interferon gamma release assay screening, which is basically a blood test, a full blood test, as well as sputum induction, which involves the obtaining of sputum samples by inducing the patient to cough out phlegm and look at phlegm and sputum and examine the bacteria in a laboratory setting. So in conclusion, we identified some major strategies, and we suggest that these could be capitalized on, and they include, just to reiterate, immunization, risk stratification, and community initiative. Although some of the limitations we identified included cost, program feasibility, implementation logistics, and recurrent disease, especially with multi-drug resistant tuberculosis. So with that being said, I'd like to conclude my presentation, and I'd like to open up the floor for any questions. Thank you.
All right. If John were able to make it, I would have thanked him kindly. But uh, we'll just keep moving on here. So.